as part of the Affordable Care Act, the new online insurance marketplace, Cover Oregon will begin enrollment next week. And there's a lot of confusion about just what to do. KEZI 9 News reporter Sarah Hurwitz joins us live in the studio to break down the process. Sarah?
Renee, changing to a new healthcare format can be daunting, especially for those who've never gone through the process before. But Lane County health leaders we spoke with say if you break it down to a step-by-step process, it's not that complicated. The first thing you need to know is open enrollment begins on October 1st. But if you're expecting to pick a plan on your own that day, think again.
If you want to apply for Cover Oregon starting October 1st, you will have to go through a community partner or an insurance agent. For the first 2 weeks, Cover Oregon is only going to be able to be entered through one of those two groups.
Community service worker Christy Wedmore says that's because the program is going through a trial period to make sure all of the kinks are out. But after those 2 weeks, you can enroll on your own. Lane County Health spokesman Jason Davis says there are a number of resources to help break down the enrollment process.
One resource that we want to direct people to is healthcare.gov.
Davis says the government website gives an easy breakdown of the new affordable healthcare plan.
Right here we have the open enrollment begins, coverage begins, open enrollment closes.
Once individual enrollment opens, all you have to do is log on to coveroregon.com, and you can use a calculator on the site to help estimate what your premium cost will be. That cost will vary depending on your age, income, and number of people in your family. Davis says the process is much like filling out your taxes, and the new federal health care mandate can be confusing. Even if you already have insurance, you might be seeing some changes.
Healthcare is changing pretty dramatically, especially for those of us or those individuals who have private health care or they pay for their own health care.
That's why Davis says it's important to pay attention to any notices you get in the mail from your current insurance provider. And if you're overwhelmed, well, you're not alone.
I wouldn't say necessarily that this process is inherently confusing or that the Affordable Care Act is necessarily confusing. It's that for years we have gone down the same road. And now we're taking a different path, and that's hard.
Now, coverage begins on January 1st, but your deadline to enroll isn't actually until March 31st. After that, you'll face a fine of $95 or just 1% of your income. Live in the studio, Sarah Hurwitz, KEZI 9 News.